All right. Well, good morning, everyone, and welcome to the Dads and Doulas Empowering Birth session. We are going to get started. I will turn things over to Sharday Burton for introductions and to get started for the day. If you have any questions, please add them to the Q&A box. And any conversation or comments, you can please add them to the chat box, and then we can see them, and we'll read, and Sharday and Dominique will answer as they come through or as the presentation allows. So again, thank you so much, and I will turn things over to Sharday.
Thank you. Good morning, everyone. I see we have a few people joined so far, so we may have others coming in. My name is Sharday Burton. I am a birth doula through North Star Birthing Services here in the Lansing area. We provide doula services to greater Lansing area and surrounding areas, and we are happy to be here to talk to you all a little bit about what doulas do and roles of dads in the birth process as well, too. So, Monique.
Good morning again and welcome. My name is Dominique Brace, and I work alongside Sharday, supporting families here in the Lansing area at North Star Birthing Services. And we're happy to have you join us today to talk about doulas and dads and what we can do to make this journey great for parents and community partners here in Lansing.
All right, great, thanks. Next slide. And we have a poll number 1 can go live. We just kind of want to know, for those of you who are here with us today, do you know what a doula is? Yes or no? If you see the poll pop up, please just submit your vote. We'll give it a minute or so, let everyone get their answer in. All right, I see 100% yes so far. I can't see the number of people that voted, but at least someone, at least one person definitely knows what a doula is. All right, and next slide, and second poll number 2. Have you or your partner ever had a doula in the past? All right, I see a 100% no for that one. All right, well, for the person or persons that knows what a doula is, I hope during this presentation that you may learn something you didn't know about what a doula is, expand your knowledge of a doula. And if you or your partner hasn't had one in the past, you know, this might give you some information if you were ever considering one or know someone that may be. Maybe you can pass the information along to others as well too. So let's see. And next slide, please. So what is a doula? So doulas are professionals, non-clinical professionals who provide physical, emotional, and educational support to birthing persons and their families before, during, and after childbirth. We are with you throughout the prenatal period, during labor, and even after birth. In the postpartum period, we provide services to birthing persons and their family. Next slide. So a little bit about what a birth doula does. And as we introduced in the beginning, I see that we may have had some people just join. I serve as a birth doula through North Star Birthing Services, and Dominique Brace, whom you'll hear from shortly, is a postpartum doula. So a birth doula provides support prior to birth, including sharing of evidence-based resources. So we can share information regarding any questions you may have, whether it's regarding your options during birth, what may happen after birth as far as testing or medications that baby may be offered at birth. Anything that you have questions about, we have evidence-based resources that we provide information to you. We don't necessarily try to sway the birthing person or their family one way or another, but we do provide them with resources that state this is what your options are, and here are some risk and benefits of them all. So we are able to be that support person for you, kind of give you some of that information that you may not readily get, with your quick visits with your OBG, midwife, etc. We can kind of delve into some of that more with you and do some of the research for you and help make decisions. And once we do that, we can develop a birth plan. And with that birth plan, we will lay out the options of, what you want your birth to look like. It can include stuff as, pain options. Do you want to try a natural birth? Do you want, pain options? What it may look like in the event of a C-section or emergency during birth. What options do we want to lay out? Whom do you want to be present with you during birth? What do you want their support to look like? And we develop all of that in your birth plan. We share that readily with your midwife or OBGYN doctor. And that is something that is kind of a living document that's passed around that to everyone that works with you throughout your care, throughout that birth process. We also provide non-medical support techniques for labor and birth. So I call them comfort measures. A lot of times we will work with the mothers to help with breathing techniques, different stretches, different positions to help not only with pain or aches that they may experience throughout their pregnancy, but during labor as well too. One good thing about the birth doula is that we provide that continuous labor support during birth. And the continuous part is so important because, when you do go into labor and you're at the hospital or wherever you choose to give birth, you may have your midwife, your doctor, your nurse in and out of that room. But as your doula, we are going to be there by your side consistently throughout the entire process, providing that emotional support, those comfort measures, that kind of physical support that we discussed. We're also there to support your partner. So dads, if you are there with your partner while they're in labor, we're also there to make sure you're staying hydrated, you're doing okay, because you are so important to the birthing person. And we need you to be healthy and strong and ready to, support them as well too. So we are supporting you as well. Maintaining a birth log. So kind of, just documenting things like if per se you're giving a certain medication, we're just documenting that was given to you and, what changes may occur outside of the birth plan, kind of documenting what happened along the way. And, this may be something that you may never reference again, but it's just kind of something that we can do as your doula. And another option is birth photography. If you're interested in any type of photos of during the birth, after, we're there. And especially now with COVID times, you are allowed, your partner or whomever your support person may be in a doula. So it may just be us in the room. And, if you guys want pictures, we are able to be there and do that for you. Next slide, please. Turn it over to Dominique to talk about postpartum.
So Chardae's role in North Star is our birth doula, and what I provide is postpartum doula services to families. So a lot of the stuff we do is similar in that we provide evidence-based resources versus what we think our opinion is or what we think is best for families. We want families to guide that by sharing those resources. So a postpartum doula serves during the 4th trimester, the 12 weeks after the baby is here and has joined the family, and what that looks like. So those evidence-based resources can be things for co-sleeping, feeding, vaccine schedules, a lot of decisions that parents have to make right after a baby is here, how they want to go about structuring their family. It's my job to help you with resources so you feel like you can make good and informed decisions based off strong resources in your community. And then another big one is information and support for feeding. We want you to feel empowered when you are deciding how you are going to feed your child and provide them nourishment, which is so important for the first year of life. And then emotional and physical recovery from childbirth, whether it be a positive or negative experience for family and mom, just making sure that you get an opportunity to share your birth story with someone that is close and that is a part of this process. A postpartum doula's role is in the home. So they come into your house, they are a part of your living spaces, staying for 2 to 3 hour windows at a time. Some postpartum doulas offer overnight services, so families can acclimate to having a newborn that's not resting or not resting on their schedule. So that recovery is really important. And then infant soothing, ways to, calm the baby, keep the baby flourishing in this new time and new space for all of them, and coping skills for the parents when trying to manage with this level of exhaustion that they have not experienced, right that time or before. This might be the first time that they have come across this level of lack of sleep, and they really need some expertise and guidance on how to be present, focused, and how to care for their newborn. Other things outside of that is doing like housework, like vacuuming, tidying, taking out the trash, those things like dishes. A doula will come into your home and provide those services because they're really important. You are going to choose snuggling with your newborn over another load of laundry. That's just how things go. Making meals. So if you have a doula and you don't know what else she can do or he can do, they can come into your home and, make a stir fry or your favorite macaroni and cheese. Also, the family has nourishment. Promoting self-care for mom and for dad. That means time alone outside of being a parent. That is a role that you play, but you need alone time to read or take a bath or relax. That is important. It's something that a postpartum doula can help you provide. Sibling adjustment and pet adjustment. Pets aren't used to having newborn babies in the home. What that looks like, making sure they get enough care, time, and attention. Then if you're already a parent, a postpartum doula can still be for you because you may have other kids in your home that need time, attention, and love as well. And so the doula can spend time with that child while you spend time with your newborn bonding, or vice versa. The opposite can happen where they spend time with the doula. So supporting those family bonds with both parents, they're both really important. Whoever is in your home, welcoming them and helping them get acclimated to their new role, their new metamorphosis, their new identity, how all that's changing, and just fostering connections so that your family can continue to flourish. We know that families are set up, if they have these resources in the beginning, they can be more successful and have happier memories, not as stressful of a time. The newborn window is long where there's restless nights, and this is a really a crucial time for connections to happen all across the family bonding. I'll turn it back over to Sade.
Thank you. Next slide, please. Okay. So a little bit about what doulas do not do, because sometimes and you guys may have heard or have people confuse kind of doulas with midwives. And so doulas, we do not perform clinical tasks. We are not going to be the ones catching the baby. We're not going to be directly doing the medical clinical interventions. We do not give medical advice or diagnosis. Again, I kind of mentioned before, we will give evidence-based information, kind of which will allow you to weigh your options and make the best decision. We don't make the decisions for you, and we do not take over the role of the partner. So dads, we're not taking your place in the birth or, through the prenatal periods. We are there to support both of you and amplify both of your voices and support you. We are not taking the place at all. We are supporting the entire family. Next slide. So this slide is a little data heavy, but this information comes from, a publication review back from 2017 This publication was the result of about 26 different trials with about over 15,000 people. And this was research on the effects of people who had continuous support during their childbirth experience. And the continuous support did not specifically have to be a doula, but someone, by their side throughout that childbirth experience. And some of these are specifically related to doulas. There was a 25% decrease in the risk of a cesarean found. The largest effect was seen with a doula. So that was about a 39% decrease in cesarean. There was about an 8% increase in the likelihood of a spontaneous vaginal birth. The largest effect was seen with the doula. Again, that's about a 15% increase. And there was a 10% decrease use in any medications for pain relief. The type of person providing continuous support did not make a difference in this specific data. Shorter labors were about 41 minutes on average. There was no data for this one on the type of person providing the continuous support to tell if that made a difference. There was also a 38% decrease in the baby's risk of a low 5-minute APGAR score. There was no data for this one on, whether it was specifically doulas or if doulas had a higher rate as well. And also 31% decrease in the risk of being dissatisfied with the birth experience. So the mother's risk of being dissatisfied with the birth experience was reduced with continuous support provided by a doula or someone in their social network, such as a family or friend, but not hospital staff. Thank you for the question in this chat. Spontaneous vaginal birth is pretty much saying it ended in a vaginal birth. There was no need for interventions or need for a C-section. So, all right. Next slide, please. So how can a birth doula support the father in this process? Like I said, we are there to support both of you, mother and father. We are there to uplift both of you and support you. So we do prenatal visits as a birth doula with the birthing person, their partner, family, whomever wants to join prior to going into the birth to kind of get to know you, develop your birth plan, and set expectations of, what we would like to happen during the birth. During this time, it's perfect time for you, the father, to ask questions about any birth, about the birth or the process that you may have, and we can provide those answers to you. We can also work with the father to show you some comfort measure positions that you could help with to comfort the mother during labor. And even before labor, sometimes you may notice that your partner is having low back pain. There may be hip pain, and there's some comfort measure, different stretches, positions that we can support you as a birth doula and show you, hey, if I'm not around, this is something you can do to help support her and comfort her during this time. During birth, I'm there as your birth doula to also remind the father to stay hydrated. So definitely I'm reminding the mother, okay, you need to drink water, stay hydrated. But the father too, we want to ensure that you are staying hydrated, you're taking breaks, because it's so important for you to be ready and able to support your partner. Next slide, please. So, and you guys can use the chat for this, but just kind of a general question. What are some things you know now that you wish you knew before you or your partner gave birth? We can say you, yourself, or your partner. So for the dads out there, as well as any moms that are. I don't see anything coming through yet, unless my chat is just delayed. Joy, that postnatal recovery, that is so good, and definitely something that is, not talked about a lot, and also a lot of support not necessarily provided, afterwards. So having, that postpartum doula to kind of walk you through all of those things you might experience through those postnatal recovery, postnatal education and support. We kind of hear that across the board, that, that's definitely something that it's not a lot of information given, it's not a lot talked about, and people wish they knew more about it or knew more about what to expect during that. Thank you for that.
I'm going to chime in just a little bit. And also, this is something that people never thought to put on the registry. We register for a lot of things like pacifiers and diapers. But if someone had said, maybe let's register for a postpartum doula, people would sign up for that. And another thing to note, as North Star, we only have postpartum and birth right now. But there are several other types of doulas, grief and bereavement doulas, end of life doulas. The doula scope is expanding, so just something that maybe wasn't around or you hadn't heard about postpartum doulas, but the growth and development is there as far as the subspecialties of doulas.
Yes, the doulas go to homes. Yep, we are in the home. We are helping with stuff around the house. Definitely, we are in your home helping you in that postpartum period. All right, we'll keep the responses coming in the chat. We'll come back to them, give them some discussion. Next slide, please. So how can fathers help during the prenatal period? Attending those prenatal appointments with the mother and taking notes of, the doctor's recommendations or guidance is helpful. There may be something that mom may forget or may not remember, but you can be like, oh, I remember the doctor said this, just kind of being there, supporting her, being that extra ear during those visits. Encouraging mother to stay hydrated and stay active throughout her birth, pregnancy. And this is so key. I can't tell you, you probably, if you think you're a good water drinker, now when you are pregnant, you need to almost double that to stay hydrated and, make sure everything's going well. It's so important. And those friendly reminders can be so useful, especially coming from partner. So remind the mother to stay hydrated and stay active, take small walks with her if you can, as well too. And looking out for signs of preeclampsia. Next slide, please. Preeclampsia, you may have heard of, is associated with hypertension during pregnancy, but it is a serious condition. It could be fatal if untreated, and going into birth and labor with preeclampsia, very high risk, but you very at high risk. But some of the red flags to look out for if your partner or you are experiencing any of these, definitely will want to contact your doctor, definitely will want to get help and seek treatment, such as a headache, changes in vision, pain in the upper right belly or your right shoulder, sudden increase in weight gain, difficulty breathing beyond what's normal because you do become more short of breath during pregnancy, nausea, queasiness, dizziness or vomiting, or swelling of legs, feet, or face, anything like that. So as a dad, look out for your partner for any of these signs. And I'm sure your partner is aware of them and probably available to tell you if she's feeling any of those. So just make sure you are supporting her and indicating when it's time to seek help. Next slide, please. How can fathers help during labor? So during that actual birth, making the atmosphere comfortable for the mother, making sure, whether it's lighting, does she want the lights dim? Is it a comfortable area? Does she want music playing in the background? Helping with that. And we as a birth doula will be able to support during that too. Help with communication to doctors, friends, and families. I'm sure once your friends and family know that you're going into labor, they're going to keep texting for updates throughout the process. Dads, take charge of that because mom is not going to be at her phone texting and replying to people. So just take charge of that if you can. Again, still making sure that she's staying hydrated as well. Being responsible for hospital bags and packing the car. You guys have that hospital bag packed already, but Dad, you be in charge of making sure it's grabbed, carrying it to the car, carrying it into the hospital, birthing center, wherever you guys are going, and just listening to the mother's needs. Speaking words of affirmation to her during this process. It's so important to help the mother stay positive and encourage and uplift her. and again, help with those comfort measures that we discussed before. Next slide, please. So what are some encouraging words that you could say to your partner, or that you do say to your partner to encourage them? Or as mothers, what would be some encouraging words that you would want to hear from your partner? I'll let those load up in the chat. You can actually advance to the next slide too while those are coming through the chat. These are just some words that, I put together, some words of affirmation that can be helpful. So fathers, take notes of these, when the mother is going through the labor, like say these to her. I love you. I'm here for you. You're going to be a great mother. We're so close to meeting our baby boy, our baby girl. You are amazing. Keep breathing. Perfect. Keep that rhythm. Stuff like that to encourage her. Your support is so valuable. And to hear those encouraging words from you during that time period for the mother is so, so important. And I think others in the chat are chiming in with some that they would either want to hear or that they've spoken to their partner. So just keep those in mind, as a partner. This is so important, and you play that great role to lift up those words. Next slide, please. So here I just gathered some pictures of kind of comfort measures to help, with mother. And these are, mainly as you're getting closer to birth. You kind of see in the first one where she has her leg kind of up on the chair. That's kind of what could be a stretch. Also to help labor progress. Yoga ball is very common. We use it in so much. Yoga ball is kind of great comfort measure position during labor, even before labor in the prenatal period. Mothers find comfort in just sitting on that yoga ball. With the bar, this is kind of like in a hospital bed, how they have this bar up and it's ready. It's a way to help the mother push throughout birth and labor. So you may see that in the hospital with your partner and can support them while they're doing that. Walking the stairs, another great way to help induce labor as you get closer to end of pregnancy. There's this rolling pin measure. It's kind of like a little back massager with a rolling pin that you see in that next picture. And then the last one is just kind of massaging mom's legs, while she's laying back, relaxing. It could be during labor, it could be before, but just providing those measures of support for her. Next slide.
So we're going to transition here a little bit into the postpartum part of our presentation, and how can a postpartum doula support fathers. So we already explained that we come into the home, but we also provide non-judgmental communication. If you're a first-time parent or second, third-time parent, there is a lot of input and advice unsolicited from outsiders. So we can play a really key role in navigating in-laws, co-workers, family members that may stop by, what that looks like for your family, how you can make good discernment of their suggestions, and then also navigating what I call a ticket to entry. If you'd like to come see and hold my precious newborn or this precious baby, the father can feel supported in making good decisions and saying, we're not available right now. Please leave that, great meal on our front porch, or please don't ring our doorbell. You will alarm our dog or our puppy. Our other child is taking a nap. Now's not a good time. But helping them set those barriers and boundaries when you are at home and you're having your nesting period, your growing period as a family, and helping the father feel communicative with others on that. And then the postpartum doula can help them view their role and all of this as unique. Dads play a special unique role, and so making sure that they feel value and bringing their thoughts and opinions to the table, helping them create a community, whether that be through church, support groups. If mom and dad want to join a family group in the area, just helping him locate and navigate those resources. And then providing skills and realistic expectations. We're not all born with this innate ability to know all of the things that will soothe and help a newborn. And so sometimes it's helpful for an outsider to come in and provide dad with those skills. And I'm going to go over those in some more detail in some few slides. Emphasis on them being a dad as part of their relationship. It's not their job. You don't clock out of being a dad. It's not a 9 to 5. So helping the father understand that they are a part of this all the time. Again, the resources and educating the father about bonding. It's not just about mom skin to skin, but the skin to skin that can be a part of dad's growth and development as well. Next slide, please. So how fathers can help during postpartum. Some key things that the dads can do during this special time where the newborn is there and we're growing and developing our family is helping her to feel comfortable while feeding. It is difficult with wrist rhythms. If you're formula feeding or breastfeeding, it takes a lot of time to get comfortable feeding a baby. So just making sure that she has comfort, whether it be a neck pillow, a massage, anything like that is helpful with feeding newborn babies. And then helping with communication to doctors and friends and family. It's really important that dad be the eyes, because sometimes the moms are very forgetful when they are back into the home. She may forget that she had excess bleeding or that she has a slight headache for 2 days. She may forget to take her vitamins. Helping her communicate that to people in her medical team so that they can watch over her and guide her. Post-eclampsia is also a thing, and it's really important that dads be that second set of eyes as mom is kind of forgetful and still in the fog of delivery. We've talked about this so much, and I just don't think we'll ever stop, but making sure the mom is hydrated well with fluids and nourishment. Dad can really help with that. Patience, we're all learning on the job when you just bring this baby home and what that looks like. Baby wearing and skin to skin, ultimately for dad, is still really important. Asking for help when needed, and helping to access the emotional well-being of mother. We know really well through research that postpartum is real and it impacts a lot of moms. The blues happens and occurs. And so dad, again, being those eyes, they are with the mom most frequently, especially as she's home on leave, if she's not working, and they can help see those initial signs of mental health decline. If mom's not progressing well, or if she's not, finding joy in some of the things in parenting that he is finding the joy in, just making sure that we're accessing that, because mood disorders, not just postpartum, will come on after baby is here. Next slide, please. So another thing that I want to touch on is the feeding. Fathers really can play a role, and this is where it tends to seem that dads feel left out because they aren't providing the nourishment, whether it come from breastfeeding or formula feeding, and that is a way that we want them to feel included. So one of the things is bringing baby to mom. Nighttime retrieval is big. Going, getting the baby out of the bassinet or the other room and bringing the baby to mom so she can either feed or latch onto the breast. Making her a snack, preferably a snack that she can eat with one hand, like a muffin or a smoothie or a wrap. But those things are key because she has her hands full with baby. Bringing her a drink with a straw so she can consume it really quickly because she's trying to stay hydrated. Dads can occupy the older kids or pets. This is a really good one. Dads can always wash bottles and clean the pumping parts. It is a tedious and long process, and you want it to be very sterile because, again, the nourishment for the baby. So making sure dad knows about all of the pieces to the bottles, the nipples, all of that. They can be really helpful with some of those tedious process with cleaning the pump supplies. Propping mom up with pillows, making sure she's comfortable, especially if she decides to do breastfeeding in a public space, making sure that she feels supported. If she decides, not to use a cover or a wrap, or if you are visiting a loved one and she has to nurse or pump in an outside space or a private room that she's not comfortable, keep her company. It can be lonely sometimes. The baby's not talking to you or as responsive if they're on your breast. So you want some care and support there. and applaud her for doing a great job. That's the number one thing that breastfeeding mom says gets them to progress, not only the nourishment for the baby, but hearing from their support person that they're doing a great job and that they feel recognized for continuing to provide nourishment for their baby. Next slide, please. So for sake of time, because we are running short, I'm just going to progress through this a little bit quicker. This is, where do the expectations of new fathers come from? And if you want to put some of that in the chat, that would be helpful. But a majority of that is from their role that they have, or the relationship that they have with their father and what that looks like. The family's culture and how that they recognize that. Also through social media. Social media sometimes tells dads what things should look like or how they should go about being a dad. Books and reading material sometimes give dads the expectation of what their role looks like. So one thing I just want to touch upon is that sometimes dads are seen socially as the financial breadwinners, and that they are financially responsible for now providing for everyone in the household. So sometimes when they have a new baby, they throw themselves into their career versus being present for the new vital time that they need that relationship to grow with the family. So just something to look at, to the sensitivity of dads, and bring out that sensitivity. It's really an expectation that can be guided by having a doula, letting them know, hey, it's okay for you to, choose family time over those extra hours, because we want you here. We want you a part of our bonding experience. Next slide, please. So going back to bonding, I'm going to just touch on a few things that are really important to the growth and development of babies, and that is baby wearing. It's an essential parenting skill and a great bonding tool for dads. Babies that are born more often cry less, which equals happier babies and happier parents. And there's been a lot of research done on this, and a part of it is because the babies are at the beginning of big people stage. From that age, they're so small, but they're at the bigger people age. So they're seeing eye to eye, and they're getting that encouragement, and they're getting that brain recognition. They're more alert. And so it's a really helpful tool with families and bonding time, especially when parents have to meet their own needs, like eating or shopping or walking the dog or preparing a meal. It's really helpful that they have this as an option, and making sure that dads have a baby wearing carrier that they feel comfortable using that fits their body type, like a sling or a carrier. Next slide, please. Skin to skin. I know we talked about this. The golden hour takes place after the baby is born, and it's encouraged for, no barriers, cloth or blanket to be between mom and baby. But dads can really be a part of this. Chest to chest, no shirt. It increases the baby's brain development. It helps with temperature. Babies are born in the womb. They've been warm and nice and cozy inside of mom. And this is really helpful for them to know that they can get this body temperature and feel nice and cozy and secure with dad. It also helps with their immune system, making the antibodies go from dad to baby, helping them feel safe and secure. Next slide, please. Father and newborn bonding is so important that they also have a new term called engrossment. So you should just be father involvement, but it's changed based off the research, because we know that dad's role is so important. It's different than a mother's role, and babies thrive off of difference. So it's really important that dads have that bonding period as well. It gives them an opportunity to be more active in their children's care. And it's just a higher degree of involvement. So it's not only about what the bonding does for dad, but what the bonding does for the baby. The engrossment period is really, really important. Next slide, please. So I'm going to go over a little bit more in detail about ways that dad can bond with baby, because again, they often feel left out and not supported, and we don't want that. They are just as important as a partner in the home. So they can help provide alone time for mom. They can do baby wearing. They can rock the baby to sleep. Skin to skin, we discussed. Reading is a big one. You can always read to your newborn right from the beginning, right when they get home, right when they're with us. Singing, dancing, serve and return like peekaboo. Tummy time, narration, like if you're cooking a meal, you can talk like you're on TV. I'm now preparing the vegetables. Babies love to hear your voice and what that looks like. Exploring, like hiking while you're baby wearing. Diaper changes, feeding, soothing, Nighttime routines. Bath time is a big one. If they're immersed in the bathtub, they feel safe and secure. And if they're used to having dad around, that will continue. And the chill zone at the play mat. Next slide, please. So you really can't overdose on the love and the cuddles and connection and skin-to-skin contact. Baby wearing, cuddles, and snuggles, they all boost the oxytocin and work as a stress antidote. You don't need to ration the hugs or make a rod for your back. And I think we have one more slide that has all of our contact information. So thank you all for being here with us. I think our session has technically ended, so I don't know if you're all still there. But this is our information about how you can reach us on social media, and our email and our contact phone number. Sade, did you have anything else?
I didn't. If there are any Q&As that we missed, Kirsten, please let us know, or if there's any last minute questions.
I do not see any yet, but there is a bit of a delay. So we can wait just for a brief moment. We do have a 5-minute break scheduled right now, more of that transition break, or if anyone needs to, grab another cup of coffee or something else and take a break before our next set of concurrent sessions. Those will begin at 11:40. So if you want to take a couple of minutes and get settled to enjoy the next set of sessions. And thank you both so very much. It was an amazing session and very informative. So thank you, Sade and Dominique. And hopefully you can join us for the rest of the conference as well.
Thank you.
Everyone.
All right, thanks. Bye.